The following segment is sponsored by Adapt Immune. Synovial sarcoma is a rare, life-threatening cancer that often appears as a painful lump near joints like the knee or shoulder. Early diagnosis and biomarker testing can improve treatment options. Dr. Mihaela Druta from Moffitt Cancer Center is here to share more. Welcome to the show.
Thank you for having me here for July Sarcoma Awareness Month.
Yes, of course. Okay, doctor, who should receive biomarker testing?
Yeah, so biomarker testing, let's start by what is a biomarker and then put in the context of cancer and synovial sarcoma. So a biomarker, it is a biological substance such a protein or a gene that can be found in the patient's blood or in their tissue. And this testing can give us not only more insight and refine the diagnosis of a patient, especially in this rare space of soft tissue sarcoma and synovial sarcoma, but it also can open the opportunities for these patients to have a more targeted and personalized treatment options. So it's extremely important for patients with cancer in general, but for soft tissue sarcoma and synovial sarcoma, given the rarity and the challenges of diagnosis and treatment for these cancers, to have this biomarker testing done early on in their sarcoma journey.
Sure. Okay. You just mentioned biomarker testing done early. Why is this so important in one's diagnosis journey?
It is important for not only for biomarkers testing, but also for a diagnosis of this rare type of tumors such sarcomas and synovial sarcoma to be diagnosed early on. And when we talk about soft tissue sarcomas, we discussed about over 50 different subtypes of soft tissue sarcomas with different behavior and different treatment options. So diagnosis earlier of these sarcomas and synovial sarcomas, they can give the opportunities for the patients to have a multimodality treatment approaches with chemotherapy, surgery, and radiation. So it's very important to have a diagnosis early on, and this can be done in a tertiary cancer center where these patients can benefit from the expertise of sarcoma experts. They can diagnose and help them in their journey and personalize their treatment options. So it is important not only for the synovial sarcoma and soft tissue sarcoma to be diagnosed early on to improve the outcomes, but also to have this biomarker testing done early in their journey to give them the opportunity to be evaluated for clinical trials, for instance, or even for other FDA already approved treatments.
Okay. All right. Thank you so much for that information. Where can we go for more, doctor?
So there are a lot of great resources out there talking about the sarcoma, soft tissue sarcomas, and synovial sarcoma. And for biomarker testing, you can go to sarcomabiomarkertesting.com.
Okay, thank you so much for joining us today. Have a wonderful day, Dr. Druta. Great to see you.